Visceral therapy is a form of hands-on work with the abdomen, a specialized type of deep massage that helps restore microcirculation in the abdominal area. Over time, internal organs can shift. A kidney may drop, the stomach can change its position, and the pancreas may become deformed. All of this leads to functional disturbances, from impaired blood flow in the pelvic organs to reduced circulation to the brain. In addition, reflex responses occur. What are reflex responses? They are the body's reaction in muscles, fascia, periosteum, and other tissues to the condition of internal organs. Take the intestines, for example. They contain reflex zones that correspond to the liver, the kidneys, and even the brain. When an internal organ begins to suffer, tension immediately appears in the corresponding intestinal zones. This is why abdominal massage is so effective. It allows us to work directly with these tense areas, gently relaxing tissues, releasing spasms, and restoring normal circulation. Nature designed the body in such a way that even on the surface of a single kidney, there are reflex zones of the liver, the pancreas, the brain, the bladder, and the intestines. When we carefully work with the abdomen and improve microcirculation, the affected organ begins to recover naturally. At the same time, working with the abdominal area leads to relaxation of the spinal muscles. This reduces excessive tension in skeletal muscles, which can compress fibrous discs and lead to protrusions and compressions. Very often, such compressions are directly related to chronic tension in the internal organs. When we view physiological processes from the perspective of the abdomen, many things become clearer. In this way, visceral therapy closely aligns with the principles of Eastern reflex therapy, where the body is always treated as a single, unified system. Let us take the kidneys as an example. In Eastern reflex therapy, it is said that the kidneys perform 17 different functions in the body. When we work with internal organs directly, we can observe these functions very clearly. Of course, we must also speak about projection zones. They appear on the face, on the body, and in the muscles. By simply looking at a person's face, it is often possible to tell things about their health that even they may not yet be aware of. For example, not all women can feel when fibrocystic mastopathy is developing, or when an oncological process has begun. But the signs are already visible on the face. If there are problems in the pelvic organs, an involuntary swelling of the carotid artery may appear. By comparing the condition of the left and right carotid arteries, we can determine the source of the problem. If the swelling is on the right side, this often indicates dysfunction in the pelvic organs. When we begin abdominal massage and improve microcirculation, this swelling of the carotid artery decreases or disappears completely. When we analyze the causes of diabetes, we see that one of the major contributing factors, especially in childhood diabetes, is parasitic infestation. If 4 out of 5 children who come in with diabetes show a clear connection to parasitic infection, then a simple question arises: why not focus on prevention? The left kidney plays a role in regulating the electrical charge of red blood cells. When kidney function decreases, this charge weakens, red blood cells begin to aggregate, and the blood becomes thick. Add stress to this, and our modern life is full of chronic stress. Long-term stress is easy to recognize. You only need to look at the tongue. If you see tooth marks along the sides of the tongue, this is a sign of prolonged stress. These tooth imprints indicate that the stomach is tense and rigid. How do we know this? When we begin working with the abdomen and start palpating the stomach, the patient often feels as if there is a foreign object inside. The stomach must be gently worked until it becomes soft as a baby's stomach. The pancreas lies beneath the stomach, so when we improve blood circulation in the stomach, the condition of the pancreas also improves. The pancreas contains many tiny blood vessels. These vessels often become clogged when the blood thickens. That is why a person must pay close attention to nutrition. Food can be medicine, but if we start consuming medicine as if it were food, that is already the beginning of the end. Sometimes, to accelerate recovery alongside abdominal massage, herbal formulas may be recommended. And here, we encounter an important truth. The same herb may help one person, while another person with the same diagnosis feels no benefit at all. Because metabolism is different in each person. In one person, it is predominantly catabolic. In another, it is anabolic. These are completely different metabolic processes. That is why, in one case, a herb works very well, and in another case, it works poorly or not at all. By simply looking at a person, it is often possible to determine that their blood sugar is elevated. During a conversation, if a person opens their mouth and the inner line where the lips meet appears red, this is one of the first signs of elevated blood sugar. That is why, when a patient with type 2 diabetes comes to us, we often recognize the problem immediately just by talking to them. Very often people come in without even knowing that their blood sugar levels are high. A person may have a blood sugar level of 20 and still feel completely normal. The first thing we do is talk about changing nutrition and drinking habits. We must drink alkaline water. Tap water usually has a pH of around 5, which is mildly acidic. Water should ideally be around pH 8. As soon as a person starts drinking alkaline water, the organs begin to function differently. The human body is a powerful self-regulating system, and when we support it properly, we see rapid improvements in health. Pay close attention to the abdomen. This is a key area that allows us to solve many health problems. And if you are a physician, even if you are administering IV therapy, but first you release abdominal tension, relieve spasms of the internal organs, and only then perform the infusion, the result will be completely different. Because our organs are often in a state of constant tension and spasm. In a healthy state, they should pulse. Just like the eyes pulse, the brain pulses, and the intestines pulse. It often happens that a patient comes in, and I clearly see that their kidney is full of cysts. But they are told, "Your tests are perfect." And in reality, there is advanced polycystic disease. And again, what is the common trend in modern medicine? Immediate surgery. Because the solution offered is simple: remove the kidney. But what if we approach this differently? What if instead of removing organs, we restore microcirculation, improve blood supply, and change nutrition? Nutrition, by the way, is a separate and very important topic. Very often a patient comes in with an abdomen that feels like a drum. Hard. Tense. How can there be normal health when the abdomen is rigid like that? All the internal organs are compressed, spasmed. There is stagnation of blood, stagnation of lymph, a swamp inside the body. But the abdomen should be soft, like that of an infant. The manipulations are performed through the anterior abdominal wall. We gently press and release the stomach, work through the area of the pancreas. This allows stagnant blood to drain, microcirculation improves, and eventually the tense tissues relax. As a result, blood sugar levels normalize and the condition of the blood changes. Many people have heard that baking soda should be taken. Of course, excesses exist, but the difference between a remedy and a poison is always the dose. When taken in controlled amounts, it can be beneficial. Before abdominal massage, a small dose of soda is given. It temporarily restores the electrical charge of red blood cells for about 3 hours. That is enough time to trigger the processes that help the body recover faster after visceral manipulation. This is a very interesting mechanism. Naturally, with diabetes, areas of tension appear throughout the body. Take the neck, for example. On the left side, where the carotid sinus is located, there is a representative zone of the pancreas. When something is wrong there, tissue tension develops. This tension compresses nerve fibers that innervate the heart. But a cardiologist usually does not pay attention to this. They treat the heart itself, arrhythmias, bradycardia, tachycardia. Yet these interconnections must always be taken into account. As a diagnostic example, the big toe on the left foot is a representative zone of the pancreas. If the nail plate of this toe is affected by fungal infection, this is one of the signs of reduced pancreatic function. Immediately, a reflex response occurs. Blood vessels collapse in the area that represents the affected organ. When we see a pronounced red vascular pattern on the face or persistent facial redness, we can also suspect a problem with the spleen. As soon as a person begins to suffer from diabetes or pancreatic dysfunction, the first thing that appears is increased sensory sensitivity. The person startles easily when touched, and gradually they begin to hear only the negative. The person begins to feel that everyone is paying attention to them and speaking badly about them. Such patients start to withdraw. They avoid social interaction because it feels to them that everyone is talking about them negatively. At the same time, a tendency toward creativity appears. The person may become an artist, a poet, and very often, as soon as a pancreatic problem develops, the person suddenly starts writing poetry. The elbow is an indicator of the condition of the pancreas. That is why, when the pancreas is affected, psoriatic patches often appear on the elbows. At the same time, hypersexuality may develop. Whether this is normal or abnormal is not for us to judge. But the most interesting thing is this. When pancreatic function is restored, this hypersexuality decreases. Sensitivity also slightly diminishes. The person stops writing poetry. And there is something else. When blood sugar levels are elevated, it becomes very difficult to eliminate candidiasis, because sugar is a nutrient medium. And if dairy products are also consumed, the problem intensifies many times over. When we exclude dairy and limit carbohydrates, this greatly helps in eliminating candidiasis. Pay attention to this. The Chinese practically do not eat raw vegetables. The Japanese do not eat raw vegetables either. Koreans also avoid raw vegetables. Why? Because raw vegetables cause abdominal bloating. And sometimes, in order to overcome health problems, raw vegetables must be restricted. Only stewed vegetables are recommended, blanched or lightly cooked. When a person begins to eat according to these recommendations, we see very good results. If a kidney is tense, dense, and has stopped functioning properly, we see swelling under the eyes, swelling of the legs. Blood tests may look normal. Urinalysis may also appear normal. But at the same time, when we begin working through the abdomen via the intestines, the pain disappears. The kidney softens. The pulse changes immediately. The quality of urine changes immediately. And the person's overall condition changes as well. The kidneys are directly connected to fear. When kidney function is restored, a person becomes more energetic, and drowsiness disappears. The person stops sleeping all day long because everything begins to function normally again. They rest during the night because the background of chronic fatigue is primarily related to the kidneys. The kidneys have another very interesting function. The right kidney regulates gas exchange. It plays a key role in controlling the level of carbon dioxide in the blood. If the level of carbon dioxide in the blood drops, you can breathe pure oxygen if you want, but oxygen deficiency will still remain. The tissues will suffocate. That is why such a person has difficulty waking up in the morning. And if they fall asleep, they may sleep all day long because of oxygen starvation. Sometimes, we even recommend drinking carbonated water. As soon as the person drinks it, they start feeling better. Patients with right kidney dysfunction often crave carbonated drinks. When we begin working with the abdomen, in some people, the pain disappears immediately. You press, and the pain is gone. The stress and spasm are released. But in others, the pain does not go away so easily. Then we need 5 or even 10 minutes of deep, careful work. This happens because the right kidney is in a state of spasm, and this leads to oxygen deficiency, which alters the state of the nervous system. Nerve conductivity changes. By working with the abdomen in this way, by performing visceral massage, we restore the function of all internal organs.